I will not be able to speak today due to where I am. I am the nurse practitioner for Integrated Services Program Children with Special Health Care Needs.
Wonderful. Always happy to have you guys. And Gina, I'm not sure which Gina this is. Gina may not be able to unmute. Right. And Jade.
Oh, hi, this is Jade with University Health Plans and Healthy You Medicaid Care Management.
Good morning, Jade. Glad you can be here, even just for a bit.
Thank you. Yeah.
And good morning, Jill Connor.
Good morning. This is Jill. I am the Director of Business Development at Shriners Hospitals for Children here in Salt Lake City.
Glad you could be with us. Let's see. Kaylee, is it Kaylee or is it Callie? I'm so sorry.
No, it is Kaylee. You were right,
Okay.
Mindy.
Okay.
This is Kaylee Otteson. I am the director of Help Me Grow Utah, which is a statewide initiative of the United Way.
Glad you're here. Yeah, actually, that's Eric Christensen told me how to pronounce your name, and I sort of remembered it. So I'm going to give that one to Eric. Kelsey Hamadou.
I am Kelsey. I am care coordinator for integrated services down in San Juan.
Excellent. Glad you're here. And Shannon. Looks like Shannon Pugh.
Yep. So I also work with the Help Me Grow program at United Way.
Excellent. Welcome. All right, Sherilyn.
I am a nurse care manager at Intermountain Pediatrics in the Mountain Fork.
Okay, I didn't quite catch that last word, last thing.
American Fork.
There we go. That's what I was looking for. Thank you, Sherilyn. Glad you're with us. And Tiffany with Utah Valley Peds in Timpanogos.
Yes, I'm Tiffany at Utah Valley Peds in Timpanogos.
Glad you're with us.
Thanks.
Great. Tony.
Hi, I'm Tony Estrada with Integrated Services Program, and I mainly work in the Ogden office.
Wonderful. And Walt?
Yes, good morning. This is Walt. I'm also with Integrated Services Program, just part of the Utah Department of Health, and I'm a care coordinator in Salt Lake City.
Wonderful. Glad you guys are here. Well, that's who I see on the call this morning, and there may be other folks joining us in a bit, but we'll go ahead and call that good and get started. Let's see, it looks like I've already advanced the slide. Let me just double check here. Yes. All right. So as usual, we like to let you know that we're using Zoom these days, and if you're able to be a part of the meeting on Zoom via a smartphone or a computer, ideally, I think you'll have a better experience if that's possible. But we'll take you any way we can get you, and we will end promptly at 10 o'clock this morning, if not a little bit before. So we are going to, as I mentioned, try something new with Zoom this morning. We're going to do a poll. And so we'll see if we can lob that ball back over to Michelle, and she's going to put up a poll, and then hopefully you have a way to interact with it and you can answer that poll. So we're looking for some input from you about mental health and behavioral health screening that you're doing in your practice. So hopefully this may apply to you and you'll be able to answer for us.
Hopefully everybody can see that okay.
I'm seeing it.
Okay, perfect.
It's got 8 questions, so it might take just a minute for some of those responses to come in.
Okay.
Michelle, are you seeing some responses come in?
Yes, we have 13 of 22 votes so far.
And I'm guessing that we won't see all 22 because, for instance, I'm looking at these questions and they don't apply to me, so I'm not going to participate.
Or if we have anybody, I don't think we have anybody duplicated, but we'll give everyone a little bit time. So.
Okay, does anybody need a little more time? All right, well, hearing none, we'll go ahead and continue on with the agenda. And thank you very much for your participation in that poll. And we did it. That's great. Woo. All right. Another announcement, and we'll be kind of doing this every month to just remind you that that Spark Autism study is still underway, and we would really love your help in getting the word out about it. It's just so easy to participate in because they've made it possible to do pretty much virtually. And there's also, an incentive for the families. And the best way we feel like to, reach these families who have autism diagnosed in the family is through folks who know about that. And that would be you guys. So if you want physical flyers, we can make sure to get those for you. You can just reach out to me and I'll put you in touch with the Spark coordinator. And you can also use a digital one if that's useful in any way. So just let us know. All right, well, we have a little bit of updated clinical content to let you know about on the medical home portal. 2 of our diagnosis modules have been recently updated, and that's constipation and asthma. So if you are looking for clinical information on either of those 2 subjects, please know that you can find those in the portal. Okay, so brainstorming time, your time. I made the COVID stamp a little bit smaller, a little bit less intense, but I didn't take it off altogether. And I think maybe that was a good thing. We don't want to let our guard down too much. It's starting to feel like people are behaving more normally. And yet we are very aware that this has not left us yet. So it'll stick around for the time being, but hopefully some of your cases are not necessarily COVID related, and we'd love to hear about them. Like updates on them, anything new that you're struggling with that maybe we can crowdsource and help with. Excuse me, also any barriers that you're encountering, any new resources, any ideas that you have. We love hearing those. This is a great place to share that information and kind of get the word out and have new ideas come up as a result. We also love to hear about any motivational interviewing opportunities that you've had or quality improvement that you're doing. So I'm going to be quiet and let you guys have the floor.
Mindy, this is Pat. I would just like to reach out to this group. I've got at least 4 children that have all been tested for autism that have come back and said, no, we don't think he has autism. But the behavior it's really problematic, as you know. If this group has any suggestions or ideas to help me find resources, I am currently working on literature search and trying to change Select Health's policy regarding ABA therapy. Basically, my question is this: what other kinds of therapies are out there for children who do not have autism that have, and I'm talking about, preschool and early school age, but have behavioral issues, sensory issues, not related to autism, but at least not related to an autism diagnosis. I'm challenging whether or not ABA therapy is or can be effective for children with behavioral issues that don't have autism. And that's kind of where I've gone with my literature search, and anything that you guys can do to help me would be greatly appreciated.
Pat, this is Angie Richens from Alpine Peds.
Yeah,
Can you
hi,
hear me
Angie.
okay?
Uh-huh.
Hey, so we've had kids in situations like that, and sometimes implementing some of those therapeutic approaches in individual, from individual places, like getting occupational therapy at a traditional, you know, pediatric occupational therapist, and then getting cognitive behavioral therapy, you know, with a regular therapist, a psychologist, or sort of, you know, licensed clinical social worker, you know, has been helpful. We've had kids that, you know, will have, you know, comorbid OCD kind of things going on, and anxieties, and we've used the OCD and Anxiety Treatment Center in South Jordan and Bountiful occasionally for those kiddos as well. So we've had to kind of piecemeal that approach when we haven't been able to utilize the services that are dedicated for kids with formal autism diagnoses.
Well, that's great. I appreciate that. I know I'm trying to get these parents to get their children involved in their school district programs, but I found a common thread, at least in 3 of the 4 that I'm referring to. They were preemies, all of them severe preemies. And yet they don't meet the criteria for autism, but their behavior is really preventing them. And so I've also tried to implement some speech therapy, wondering if communication issues was a big problem and a source of the frustration in the behavior.
Great idea. Yeah.
So Pat, let me just ask you a question. Let me clarify. These kids did or did not have an autism diagnosis? Did you say they had one, but that the families don't feel that it's really accurately describing their kid, or after the autism testing was just determined they didn't have autism?
That's a great question. Thanks for clarifying it. They did not have a diagnosis.
Okay.
Yeah.
Okay, perfect.
Yeah.
You know, we get a lot of people, a lot of times are looking for second opinions. You know, they'll get that autism diagnosis and then they don't agree with it. So no, thanks for clarifying. I appreciate that.
Yeah. And I have one of the 4 that's saying, I don't think he has it, and I do want a second opinion, or I do think he has it, and they said he doesn't, and I do want a second opinion. And I will always encourage the parents to get a second opinion. I'm just looking for some ways to help with the behavior, because I think they can do better in school if we can meet that behavioral need.
Pat, when you talk about, you know, them testing negative, or that, you know, they were they evaluated with the traditional ADI, ADOS
Yes.
methods?
Yes.
Okay.
And Pat, how old are the kids? Did you already say? I apologize. I have fuzzy brain.
No, and take care of yourself, Eric, but they're between the ages of 3.5 and 6.
Okay, and so are they involved in, like, you know, Part B, like special needs preschool or anything like that? What I'm just thinking is, a lot of times when they're doing, you know, assessment to determine if these kids qualify for a Part B preschool, they do, you know, speech evaluation, audiology testing, you know, checking for auditory processing concerns, some of the functional pieces like, you know, occupational and physical therapy, you know, parts and pieces like that. So a lot of times in getting them prepared for preschool, they do a lot of that testing. I have a little nephew who they actually discovered autism while they were doing, you know, referred him out for testing when they were doing this preparation to get him into special needs preschool.
So what's Part B, Eric? I don't know what
So
that is.
Part C is early intervention up to age 3. Part B is special needs preschool. The criteria to get into that is more stringent than what than qualifying for Part C early intervention. So in the up to 3 range. Part B is basically between, I want to say, 3 and kindergarten, and it includes typically special needs or kind of almost special education preschool.
And is that
so
something?
I think there's some prudence in working with the school district on some of these kids to see about some of that testing. You know, because if you do discover some of these issues, like you discover there is, you know, not autism, but sensory processing disorder, like through occupational therapy, or some speech apraxia or things like that, then some of those things can be addressed and, help the kid to fully be ready to, try to jump into, regular school services.
Oh, all right. Well, thank you. Just having my thoughts validated is helpful because I thought maybe they really can't hear.
Well, and if you need more help with that, Pat, you can always reach us offline too. We'd be happy to just kind of consult with you on that. Tony, Walt, Natalie Allen, our nurse practitioner, any of them would be happy to kind of discuss some of that stuff with you as well, just to, so we can help ask the right questions to the family to get them in the right spot.
And Pat, sorry, I'm sitting in a doctor's office, so I shouldn't be talking, but I have my headphones on so no one can hear. Also, depending on how premature they are, Pat, if they qualified, they're probably too old for neonatal follow-up by now, huh? Never mind. Okay.
Yeah. Yeah, but these are kids that have, done surprisingly well considering they were, anywhere between 23 and 25 weeks preterm.
So did they attend neonatal follow-up clinic?
Yes, it looks like they did, as I've read back through the histories of those that I could, take a look at. I always look to make sure that these kids, when they graduate anyway, that are under my purview, that they get into the post-NICU discharge.
Well, I'm surprised they didn't give you with a better plan. But anyway, usually we try to graduate kids from that program with a nice plan in place. So anyway.
Well, and it could be, but I'm just not sure of the right questions to ask the parents when I talk to them, because what I'm trying to do is find the resources and help these parents maximize their benefits.
I worked in neonatal follow-up for 15 years when it was under the Department of Health. I would just ask the parents, what sort of reports do they have from neonatal follow-up program? Because, it's a multidisciplinary team, and usually you have OT-PT speech, at least. I don't believe they offered audiology through University Developmental Assessment Center neonatal follow-up program, but they would have been meeting probably with a developmental pediatrician and a psychologist. So I just kind of wonder if you get some of those scores on like a Bailey, the PLS score or whatever they're doing for speech path speed, you might be able to get some scores and look at what the history was once they were kind of let loose from neonatal follow-up. So maybe getting some of those records might help to clarify the picture a little bit.
Oh, thank you. That's a great idea. And then if you have names of the developmental pediatricians, to the best of my knowledge, I only have 2. But I'll take any of them that you've got that are in or out of network. I don't care. I'm becoming an expert of getting cases approved to go out of network because I just know the resources are there that I don't always know about. So anybody who's got the names of developmental pediatricians, I would gladly take. Thank you.
Well, we can help you with that, Pat.
I bet you can.
We can. Yeah, as a matter of fact, we can probably address this very thing a little bit later in our meeting. But yeah, what I'm looking at right here, I just got to the category of developmental behavioral pediatrics via our premature infant follow-up module. So this is listed, sorry. This is listed as a series of specialists that we would expect these kids to need. And so you can see I've got all of these on the screen. I'm going to mute for just a second.
Mindy, we can't see your screen either.
Oh, I'm so sorry. I thought that Zoom would follow where I was sharing, but apparently not. Let's see if I can do that real quick. I don't want to take too much time away. Sorry, here's that technical difficulty I was telling you about. Okay, so I've been navigating all over the portal while you guys were talking, and you couldn't see anything. Yeah, and the chat has some good information in it as well. I was thinking of those very same folks. So yeah, Pat, here is our developmental behavioral pediatric category. And so we don't necessarily show just individual provider names as these records, because we know that individuals come and go from these organizations, and sometimes they really aren't the right person necessarily, but contacting that organization can really help with those referrals to get the right provider for the family. But all of these organizations provide this service. And we will make sure to highlight this in our resources of the month for you.
Thank you. I knew you guys were going to be talking about this, so I thought I'm going to take advantage of you.
That's right. That's right. Excellent. Okay, well, I won't deviate us too far off, but yeah, I think that was a really good and helpful conversation, and we'll make sure we grab all of that information when we send it out. I did note a couple of things in the chat I want to bring up. So Jade mentioned the wiggle worm program that Easter Seals used to do, and I just double checked. She's right. It hasn't been going on for a while, and I know that the champion of that program, her name is going to escape me right now, Janet Wade, has retired. So she's doing other things now. And so perhaps that went with her, but that would have been a good one, Jade. I agree. I was totally thinking about that, unfortunately. And then, yeah, Eric and Walt mentioned several folks who are affiliated with UDAC. And so they're a terrific group with the developmental and behavioral. So Sarah Winter, who helped write our pediatric premature infant follow-up module, and Paul Carbone and Allison Elsie are terrific in that space as well. Okay, anybody else? I didn't mean to cut the conversation off. If there's anything else you guys want to talk about with Pat's questions, please continue, or we can move on with the agenda. All right, let's go ahead and I'll pop back to the PowerPoint and see if I can share it appropriately. My excuse is that I have too many platforms that I have to be an expert on. I don't know if that's a reasonable excuse. All right, hopefully you're seeing the slides again. So here's where we wanted to do something a little different this morning. And if you'll bear with us, we'll see if it works, but we want to use the breakout feature of Zoom to divide us into 3 different groups. And each of those groups will have someone from the Medical Home Portal team who will act as kind of the guide and the moderator. And we're going to show you a few cases and give some time to have these groups of attendees come together and use the Medical Home Portal as a way to try and find resources, whether it's a content resource, whether it's a link, excuse me, to like an external site or a PDF that's there on the portal, and service providers, which we focus on a lot in this meeting, and kind of try and identify the things that might help the family in the case. And we're going to have a little bit of a competition. So we want to incentivize you to see if your team can come up with more of those things than the other teams. So that's what we're going to do. We're going to have Michelle be she's going to control the breakout rooms and help get you moved into it. And that might take just a minute because we're still kind of figuring out how to do that. So if you'll be patient, that's what we're going to do next. We're going to go ahead and put you in a breakout room, and we're going to be in there for approximately 30 minutes. And we'll just see how it goes, but we're really relaxed and no big deal. Hopefully that, the smaller groups will mean you feel really comfortable interacting and talking. And while the moderator in the breakout room will be able to drive and show the portal, you're also very welcome to use your own device. So if you would like to help your team by being on your own computer, you're welcome to do that. All right, so let's see. Do you want to give it a go, Michelle?
Yes, in fact, I have everybody ready to go to rooms, so I'm going to open those up now, and hopefully if you see a join click that. Otherwise, I think it should put everybody in there.
Okay, awesome. Here we go. All right, guys, we're in room 3. How's everybody doing? Oh, I get to see some of you. That's great. It's harder for me to see when I'm in the presentation mode. How's it going, guys? Good to see you. I love it when I get an extra person because of Southwest Children's Clinic having 2. That's my bonus people. Awesome. Okay, guys, let's see if I can share the cases. So the clock is ticking just a little bit. And let's see if I can figure out. Here we go. All right, let me know if you can see the word doc.
Yes.
Great. All right. So Ileana and Janet, Shannon, Kaylee, Tina, welcome. Sherilyn, Patty, and Natalie. We are team 3 and we want to win. So with this case, mom and daughter are medically complex. Mom is not able to drive to the appointments they need to get to. They live kind of near Tooele, but they have appointments in Salt Lake that they need to get to regularly. And they need safe transportation that is not costly. And they both have Medicaid. So with that in mind, we can go to the medical home portal. See if I can share that screen. And we can start searching for
Medicaid has a program that they pay for transportation.
right. Okay, so let's figure out how to find that. So let me just go back to kind of the starting point, and I want you guys to tell me what to do. Can you see the medical home portal on my screen?
Yes, I cheated and put transportation at the top in the search.
Oh, that's not cheating.
Okay.
That's exactly what you do. Transport, if I can type. All right. So let's see. One of the things that you can do right up here at the top is you can kind of hone your search. So if we're looking for, it sounds like a Medicaid service. Let's go there. Let's go to services and see what we can find. That's interesting. I wonder what priority 1 transportation is. I'm not familiar with that. But if you guys see Medicaid in here, just tell me. Here we go.
There we go.
Okay, let me look at that. Let's see, non-emergency transportation, motive care. And so for individuals in Utah who are eligible for traditional Medicaid services and don't have transportation to medical appointments. So it looks like there's the UTA bus, there's paratransit, and then there's motive care, which would be probably something even on a smaller level that's more individualized.
Yeah, that's more of a door-to-door.
Okay. And you have to call in advance to set it up. But that makes sense. Ooh, all right. Everybody feel good about this one?
Mm-hmm.
I'm gonna grab that, pop that into our Word doc.
Mindy, and something we played with too, we put transportation and then Medicaid, and it brought us right up to this page.
Oh, brilliant.
Yeah.
Look at you.
It was Janet's idea. I can't give myself too credit.
Nice, Janet. Okay, so I'm curious. Let's just do that. Let's go back to the start. And you said transportation. And did you do and, or did you just do Medicaid?
I just put Medicaid.
You know, when I'm on the phone with somebody and I'm in the portal, that's the quickest way for me to pull something if I need it.
There it is. There it is.
Because I know it's usually going to take me to something.
Right.
Because I'm such a Googler. It's like I can Google right in the portal.
Yes. Yes. Wonderful. Okay. Okay. So we want to not only do the services, which is great, right? We've totally found a service that's going to help this family. So that's awesome. But we want to also look for anything else that might be useful to them in terms of information on the portal. So while we're in here, let's just scroll. Let's just glance at what else came up in the search results. So transportation and travel for people with disabilities. Shall we take a look at that? Let's just glance at that. This is for young adults. That's not quite the same. So let's glance at this one. Here's information on non-emergency medical transportation. So let's look at that. If I had clicked on that, I could just jump down to the section, but I scrolled instead. NEMT. States are required to make it available to Medicaid beneficiaries. For a summary of your state's NEMT eligibility and coverage, see the resources section below. Okay, so now I'm going to go back up here and click on the jump link to resources so I can just get down there a little bit faster. And there it is right there. So here is
go to the federal, the national site, and then it'll give you like a map or something for your
exactly. Yeah. Yeah. So I'll just grab this too. We already found the more specific link, which is great, but this could be helpful, you know. So I'll go back to our Word doc and plop that in there. Great.
And then just for the coordinators, since you guys have the person that actually took this call in your group, one other thing we did do, because, you know, she just wasn't sure with Stansbury and all that, is we checked with their local, there's a lot of local, like little city Facebook groups out there. And we gave her the links to those so that she could ask around if there's any like people who carpool from Salt Lake, different things like that. She was really not wanting to do public transportation, but I told her it's probably the best route and it's really reliable. When you're doing non-emergency, they're pretty good about picking you up on time. But so yeah, we did add that little piece too, just to see if she could ask, you know, local people what they're doing and how they're getting to and from Salt Lake.
So Tina, what I'm hearing you say is that talking to your family-to-family health information center could also put you in contact with, you know, social media groups or other peer-to-peer kind of stuff that could be helpful. Does that sound like something I should include?
Yeah, I think so.
Okay. Great. Kaylee,
try to think out of the box as much as possible, because you just don't know, you know, what options might be out there.
Definitely. You have to be creative, right?
Mm-hmm.
Very nice. Okay. Okay, so let me just show you what I've got here on the notes, because I don't think you're seeing those. Let me share my Word doc. So here's what I've typed up. We've got the service provider through UTA, this is that Medicaid benefit, right? Right up here. And then we've got the content page that talks about, you know, kind of the requirement that states have to make this non-emergency medical transportation available to Medicaid beneficiaries. Then we've got the link to that federal website that talks about the requirement and then probably has links back to every state and their services. And then we have this great idea about getting in touch with the local family-to-family health information center. I can't talk and type at the same time. Nice. Okay. Very good. I love it. I love it. Okay, do you guys feel good enough about this one? We can go on to the next one. I'm not seeing your faces.
Yes.
Yes? Okay. Yes. Okay, great. Great. All right, so let's go to case 2. Okay, this one's a little chunkier. A few more things. Sorry, I didn't mean to use that word. No disrespect intended as I'm glancing at the details now. Yeah, there's a few things going on with this family. Family who are in the Davis County, Farmington area. The school is concerned, child hasn't been attending. Family only speaks Arabic. The child has a number of things going on that mean he's not really able to get out of the house. So that includes broken wheelchair and obesity. And families really struggling. They need, DME. They need support. They need help with interpretation and language. So we got a lot to try and help them with in this one.
Can I give a tip?
Or no? I feel like we're cheating a little bit with Tina on our team. I love it.
Well, okay, just so you know, when this call came in, the CPS caseworker was really looking for somebody to just take over this case and handle it. Mm-hmm. And so we kind of went back and said, wait a minute, you're CPS. So don't you have language services within the state? Don't you have, so just remember those thoughts, and that it is really their job to try to support this family and help them with
okay. Now, what's CPS?
Child Protective Services.
Well, Janet cheated and she said Shriners.
That's not cheating. You guys are funny. You have a pass to cheat. If you're using the medical home portal and calling that cheating, that's good. That's your pass.
Well, and remember too, we want this kid to get out of his house as soon as possible.
Okay.
So, Tina, I don't need to change the subject at all too, but we have the same problem with CPS calling integrated services and asking us to do things that they're supposed to be doing. Anyway, that's crazy.
I'll tell them to go back and talk to their boss.
Oh, okay.
Okay.
Okay. The problem though, of course, is that the family still needs help even while we're trying to get the politics or whatever dealt with, right?
We always help them, even though, yeah, we always do. Yeah.
Okay, so Tina's given us a little hint here, and then we've also heard about Shriners for the wheelchair, right? So let me just pop back to the portal and put in Shriners. Janet, how did you search? Am I on to it? Or did you just know it and you didn't search? Okay, yeah.
We can find it on there though.
Oh yeah, so I see it right here. So we know that they've got this terrific program to help with, custom wheelchairs and that sort of thing. So I'll pop that on our page. Let's see. Are you seeing the medical home portal now?
No, we're seeing only the case.
Yeah, sorry. I wish it would follow me there. I'm sure there's a way to do that. But I haven't figured it out yet. Okay, so here's medical home portal. Here's the Shriners wheelchair program. What else, guys? Because that's going to take a minute, right?
So there's loaner programs out there, but I'm not going to tell you where they are.
Interesting. Okay. Okay, guys, tell me what I should search for.
Should I be telling you?
Putting loaner wheelchair, maybe? Nope, that gave me nothing.
I'm going to try loan.
What is a wheelchair? What type of technology is
Oh.
DME? Is that what you're saying?
Maybe.
Maybe.
Or would it be like adaptive technology? Is that too broad for a wheelchair?
And guys, I use a lot of sources for what I do every day. And so that some of this stuff is just in my head, and yeah. I would just have it to tell the person right away.
Am I on to anything here with Utah Center for Assistive Technology?
Yes, I'm just going to go ahead and let you guys know. So there's a loaner program at every independent living center.
Ah.
find any independent living center on the main Salt Lake State page under resources, because they're by county.
Okay.
There's also a program called Ability Found. And I'm not sure.
Look at that.
Ooh, that's nice.
So yeah, and if you go into resources up at the top and go to Centers for Independent Living, it will tell you by county, serving Salt Lake, serving Utah County. If they're by county, they're state-run organizations. They help with a lot of stuff.
Nice. Okay, so
way back in the day when my son 20 years ago put a wheelchair lift in our van for my son. So there's a lot of resources. And just to let you know, I think they have some money in their pockets right now. I think it's, I think I heard that through the grapevine.
very nice. Okay, so for our Farmington family, it would be this Roads to Independence one that serves Davis County. Great. Okay, so this is independent living.
For loners.
And then we'll put the very specific one here, Roads to Independence, Davis County. Okay, so so that that's going to help with the wheelchair, and that's a big part of this.
Bath chair too. We did.
Right.
talk-
Oh, it'll cover the bath chair too. Okay.
Hopefully.
Right.
Another thing we did do is her and I, as we were on the phone, searched Amazon for, because I was kind of pushing her to say, doesn't CPS have some funding to assist this family? Couldn't they buy him a bath chair so he could at least take a bath? Because the point is family preservation in a situation like this. And so guess what? She said, yeah, I think I could request some money to buy it.
Oh, Tina.
I know.
Yeah, you're helping others do their jobs. Thank you so much. But that, I mean, that's just such a testament to, you know, to what Utah Family Voices and Utah Parent Center does, and the power of having experienced it yourself and knowing where to look and what to ask. And, you know, that's huge. That's huge. Okay, so that's amazing. So going back to the Word doc, I'll just mention that CPS should be handling the case. Ask if they have money to support any of these needs, right?
Yeah, if they can't get like a loaner or a free one.
Money or resources. Okay. Got it. Goodness. Okay. All right. What about a nutritionist or a nutrition coach? Anybody have thoughts on that, or how I should look for that?
No, but I need that, so I'm listening.
Okay.
So in a situation like this, I would probably say that, the child should be seen by somebody, maybe at Primary Children's or through the university programs. There are really good nutritionists at, in the Eccles building across from Primaries. And in this situation, to try to get this kiddo's weight down, because not only is he 300 pounds, but he's short in stature. So he has really got a lot of weight on his joints and everything. So I know that they do have probably some programs that address obesity within Primaries. I didn't quite, maybe I did give her that.
I know they do, Tina, because I was trying to get a patient in there. The biggest challenge was the weight. I called about a month ago, and the first available appointment that they had for me was till August. And it was for like an 8-year-old that was 200 pounds.
Mm-hmm.
And I was trying to look for that. And that's why it's like, oh, this is really interesting for me, because I don't think she's gone in because they've been trying to do other stuff. But the pediatric group at the university does have like a whole program that includes also counseling and nutrition.
Okay.
So that's interesting. So as I look on the map, I'm not seeing anything that's specific to, you know, obesity or
I think
specific,
it's that one, the pediatric gastro.
the GI.
Yeah,
Okay.
the GI group. Yep.
Let's take a look at this one.
Yeah,
Okay,
nutrition.
there we go. There's the fun. That's what I was looking for. Okay, great. Okay. So let me pop this one in here. But let's also look because let's just search obesity because the medical home portal has a full diagnosis module for obesity in children. And so there's certainly a lot of information here, but specifically we could also look for nutrition over here in the treatment and management in the systems area. And then this would give us some providers by clicking there. And look, there it is, top of the list. And then, yeah, we saw this one before as well. Education program, that's maybe for down the road. There is this one. How old is this young man? He's 16, right?
Yes.
I think that's right. Thank you, Tina. Yeah, so this one, I mean, I'm not a clinician, so I have no idea, but it seems like maybe we could put this on the Word doc as something that came up in our search. Would certainly be dependent on.
I have to be careful on that one just because they're not necessarily seeking bariatric. That sounds like it's a surgical.
Yeah, yep, it is.
And I think that would be something I would rather have a doctor suggest to them.
Oh, I totally agree. So yeah, not going to put it on there. I will, however, put the content module. So obesity in children. Sorry.
I'll be right back.
You bet. I'm just adding this to the Word doc. Okay. Let's see.
I know you guys are probably better at this than I am. Sorry, I'm the nurse practitioner, but I don't love to, but I have to encourage families to say, you'll never get off the waiting list that you don't get on, because I feel like we get discouraged by saying, you can't get in until August. Well, guess what? August will roll around and we probably still haven't found anything. So get on those waiting lists. I know it's discouraging, but do it anyway. Yeah.
And which waiting list are we talking about specifically?
Was it the fun clinic? Somebody said earlier, I think that it was the
pediatric gastro.
Yeah. Yeah.
Gotcha. Okay.
And you're absolutely right, because it was about a month ago and now we're in June, so it's really 2 months. And we didn't do that because I guess they do have a program where you could do a doctor to doctor call. And I don't know if that ever happened, but it's so hard sometimes because it's like when you follow a case, it's like you've got to stay on it. But as a manager, you have so many other things that you're looking at, and it pops in my head every once in a while. It's like, where is this case at? Because it's sitting with the provider and the medical assistant to get the resources for this patient.
Yes.
And sometimes I think people get on waiting lists, and so you may go up the list quicker than you think, because all care coordinators, everybody's out there looking for services, and maybe a family's on 3 lists. And so when their time comes up, they've gone somewhere else. So I don't know. Sometimes it just get on the list.
I learned.
That is huge. That is huge. Okay, so there's one more piece of this that we haven't directly addressed, and that's the language. We know that CPS should have interpreters, right? If they're being a little obstinate, that can be tough. But we know that the medical home portal.
We could search for translation services. I'm certain they have resources.
So I'll just show you that they could read, in fact, all of this information in Arabic on the portal. I'm gonna undo that because I can't read Arabic, and that would be not so useful, but that's certainly something that could be helpful. And then you're right. So let's look for, do we want to say translation or do we want to say interpreters? Let's try interpreter.
I think that's better because I tried the other one.
Right.
And to be fair to this little caseworker, I could tell she was really young, not very experienced. She did ask if we had interpretation services at the parent center. And when I got that call, I was like, I'm gonna call and talk to her a little bit more about, and then when I talked to her, I figured out she sounded like she was probably my daughter's age, when I said, look, we're a nonprofit and we will offer those services if necessary. We like to try to not spend that kind of money if we don't have to. So CPS is a state office and maybe you guys have those services available. And that's when she went, oh, maybe we do. So you just remember those kind of things too.
Okay.
Not that we wouldn't do it. We would do it for a family, but it does cost us money out of a nonprofit budget to do it.
Okay. Okay, so that's interesting. I don't think we have, Utah Family Voices, Utah Parent Center in this category of interpretation and translation services, probably because that's not something specifically that you do.
Yeah, we would hire one of these guys.
You would hire one of these guys, but it might be helpful to know that in a pinch, that is a thing. I'm curious. So let's look at Sorensen Communications. What is it that they do? They provide professional interpreters, but there's going to be a cost to that. So we really want CPS to handle this, don't we?
Yeah, we really do. It is kind of it's their case right now.
Yeah.
It's really hard trying to make it my case, and I'm happy to help with all of it, of course.
Yeah.
Hi, Adam.
So the description for this category of services in our directory, interpretation and translation services, it talks about programs that enable individuals who speak, read, or write a language other than English to get their needs met, to communicate. However, it looks like some of the programs are going to be a little bit more focused on, for instance, individuals with, hearing constraints, refugee status, who are blind or seeing impaired, that sort of thing. So probably, yeah, these aren't going to be the best fit. The best fit in this case sounds like, from the case information, it's going back to CPS. Right, so let me show you the Word doc and see how we're feeling about that. And then if we are okay, we can move on to the third one. Okay. Okay. You guys feeling all right about going on to the next one? Okay, I'll do it. Okay, so here's our last one. So family just moved to Utah from California, and their child has a number of things. So child has CP, has a tracheostomy, a feeding tube, and has epilepsy. They use a wheelchair and require DME supplies. And in California, through Medi-Cal, they had a lot of services, including respite. They are in Provo, and they need to figure out what is available to them here now. So let's see what we can do for them. Okay, I'm going to go back to the medical home portal. And we'll start just fresh. All right, anybody want to tell me what to look for, navigate to, search for? So we want to maybe look for DME. That seems like
Yeah, DME supplies.
I'll probably go right into services here. And oh, okay, we have less than a minute. We're going to go poof in just a second, guys. Let's go to this service category, medical equipment and supplies, and let's look for Provo. And there's two. So Intermountain home care equipment and a B&H pharmacy. I'm just curious. Let's see what B&H pharmacy says. Rental or purchase of medical equipment and supplies. And then Intermountain. So this one looks maybe a little bit more broadly appropriate.
I was going to say here in Utah County, I use Intermountain a lot more than B&H for any.
Sure, sure. Yeah, that makes sense to me. Okay, my guess is that we're about to not. Hello.
Welcome back.
Looks like everyone got muted. So just FYI, you're probably muted by default now. So, hey, that was fun. I had a great time. I hope the rest of you all in the breakout rooms had fun. We did some good searching and chatting and brainstorming. So I think at this point in time, we get to kind of show the results of what we did. And so would the moderator from breakout room 1 like to show us your results?
Sure, that was me. I might not have been typing as fast as everybody was speaking, so we'll see how well I captured everything here. But and we kind of ran short on time on our last case there. We got a little cut off. But these are some ideas that we came up with for the first case. So some content links to information in the family section around transportation. And then this was an external PDF that we linked to as well about non-emergency medical transportation. And then these are a few of the names of the service providers we came up with: Motive Care, UTA Paratransit, Mobility Transit Services, and Utah MedRide. For the second case, same thing, we linked to content and we explored the language feature in on the medical home portal about being able to put all the content just in Arabic. We linked to this external LiveWell PDF, and then these were some of the service provider directories or service providers that we thought would be helpful for the family to connect with: Davis County Schools, Asian Association Language Services, the seating clinic at Shriners, and also the skeletal dysplasia clinic, the adolescent medicine clinic, and then Little People of America for funding and support groups. And then this one we got, like I said, we ran a little short on time. So we had just started brainstorming some of the services providers, the CP clinic at Shriners, treatment clinic, and then connecting them with a PCP in Provo County. We had Utah Valley Peds and Alpine Clean Peds, and then also neurology, Clint Nielsen, and the seizure fast track. And I didn't even finish typing this one, clinic. There we go. So.
Hey, was Gina in that group?
No.
Oh, okay. Sorry, just wanted to ask.
I have to say that's pretty impressive.
Yeah,
that's pretty impressive. So, all right, okay, you've set the bar high. All right. So that was breakout team number 1. Congratulations, you're in the lead. Let's go ahead and go to team 2.
Was that me?
I think that's you. That must be you, Chuck, because we're
Okay.
3. So
okay. So I'll share my screen. So I'm embarrassed that I did not even think to lead us into the content. So we really focused a lot more on the services and service providers, and found a couple that weren't in the portal. So for the first case, we had similar things, and we noticed that logistic care is now motive care, though that's not obvious from their website. But the service sounds like it's the same service that was already mentioned. It was mentioned that Primary Children's can support transportation if the visit is to the hospital through Uber vouchers. Mentioned, tapping into volunteers or religious organizations. And Ride United is a United Way and Lyft partnership that's not meant for long-term or repeated episodes, but is available sometimes within minutes with a very short application process and pretty responsive in terms of being pretty responsive in terms of time frame. So, and there's apparently an app that's available to facilitate that. So that was an interesting one that and the starred things here are things that we need to make sure we add to the portal. For the second case, there's something called Language Line that's available for translation. Again, that we didn't have listed in the portal. That's a national service that's been used quite a bit by a couple of our participants. Mentioned UCAT for some of the technology issues, PCH and Shriners for the specific services regarding medical and nutritional things and wheelchair and mobility. And then Home Watch Caregivers was mentioned. That is in the portal, as to provide home health services and training for the family and the patient, particularly with regard to the activities of daily living.
Chuck?
Yeah.
Sorry to interrupt. I'm just curious about that language line. By any chance, do you know if there's a cost for it?
I don't. I think it was Walt who mentioned that.
Yes.
Yeah.
Yes, there is a cost for it, but it's not very much, at least through our contract. It was quite reasonable.
I see. So ISP has a contract, or the state has
Yes.
a contract. Okay.
Yes.
Yeah, and the thing is, if a care coordinator helped, like if it was from us, then we cover those costs. I don't know how other provider offices do that, but it's, I'll get a bill from them and, they will have spent, 20, 30 minutes sometimes, and it's just a few dollars. And so it's really not a crazy cost.
Oh, that's very nice to know. Okay. That's kind of that insider information we just got,
Right.
you guys. So.
No, that's a great follow-up question. Yeah.
Okay.
And then for the last case, you mentioned the DSPD wait list, and that respite services are available while on the wait list. Of course, Medicaid if they haven't already applied. We didn't know if SSI, assuming the patient or the family was on that in California, would that automatically transfer, since that's a national program as opposed to a state program? Does anybody know?
They just need to change their address and keep SSA updated.
Okay.
Medicaid is different. Medicaid they'll have to apply for because it's a
Right.
state-run program, but SSI is federal.
Great. Okay.
And the federal and the benefit changes per state. So your benefit is based on the state that you live in a lot of times, whatever that SSI supplemental, cost is sometimes. So that can
and is that correlated with the services provided by the state? That is, if you come from California where you get more services, do you get more SSI in Utah?
Nope.
No, didn't figure that one.
You get what you get in Utah.
Right. And then using Utah Parent Center and other community supports was strongly supported, and then making sure that special education services are being received through the schools. The story on NPR this morning mentioning how many schools around the country have yet to restart their special education services. So making sure that those are intact.
Very nice. So a little bit of a different approach, but really helpful. And I think that, were these active cases, these families would be getting all sorts of potential resources. That's wonderful. Okay, so I'm going to see if I can share my screen now and show you let's see, let me get to it real quick. Hours. Okay, so breakout room 3. So we had, a lot of the same things that that you guys did. Certainly, we found the provider here that references paratransit, just UTA system, motive care. We looked at the content page that talks about transportation and travel for people with disabilities. It talks specifically about the fact that there are non-emergency medical transportation benefits to Medicaid holders. And so this link here is an external link that would talk about that, that state requirement, and then link to, it's the same one it looks like as Team 1. And then we talked about using Utah Family Voices, Utah Parent Center to think creatively and find other families in the area who might be traveling to Salt Lake. So in this particular case, in fact, the family was put in touch with some other like social media groups that could help get to that very specific request. All right, so with this one, I'm gonna do a full transparency and say that, we had Tina in our group, and so we had a secret weapon a little bit as well, and she helped remind us that even though the care coordinator in this situation would want to do everything they could quickly to help this family, that the Child Protective Services caseworker, that's kind of their job. So we should be encouraging them to look at all of the resources that they have available to them as well. So prompting the caseworker who is calling for help to say, hey, does CPS have any resources that could help with a loaner wheelchair, with a loaner bath chair, or buy an inexpensive bath chair? Go ahead, Tina.
Interpretation specifically.
Yes, they really should be able to provide the interpretation services there. We looked at the interpretation and translation service category in the medical home portal, and the ones that are listed there really didn't make sense for this family and would be costly. We certainly recognize that Shriners would be terrific for help with the wheelchair specifically, and other services. Apparently, independent living centers all have loaner programs. And so we were able to drill down to the independent living center in Davis County, Roads to Independence, and they have a loaner program there that we could connect this family for something quickly, we think. The follow-up nutrition clinic at primaries would be something we refer them to and encourage them to get on the waiting list as soon as possible. And then our obesity in children module on the medical home portal would basically point to all of these resources as well, all of these specialist referrals. All right, so we ran out of time. We had lots of good conversation and we ran out of time on this last one. So what we started looking at for this family was DME in the Provo area. So we found the Intermountain Home Care in Utah County and listed that. But I really liked all of the other suggestions here. DSPD and respite, that's terrific. The other programs through primaries, terrific. So like I said, I think all of these families were going to be very well supported if we had done this brainstorming for them in a timely way.
So one for you guys, real quick with this last one, if it's okay. So we got to remember that this kid has a trach, and so DSPD would not be necessarily the correct resource, because trach kids usually use the technology dependent waiver or the medically complex children's waiver. There's just not the skilled nursing services. I think it's changing now, but they would want to look into all things before they'd applied for DSPD and figured all that out. So probably call us too to figure out what the appropriate one would be.
Yes, and I'm delighted to say that I'm trying to just grab Tina as an ongoing resource for UCCCN. So she's got so much knowledge and experience, such a great resource. And I don't know if you know, but I do really use her as my secret weapon a lot for UCCCN. Questions come up and I shoot them over to Tina. So thank you, Tina, for helping us with this exercise and for your wealth of knowledge.
You're very welcome anytime.
And I just love your background so much. So yeah, based on what I've seen, I think that teams 1 and 2 did really well. I'll give team 1 points for formatting. Looks really nice, Athena. So easy to view. Yes, I think team 2 got some nice points for coming up with some additional resources that we're going to get in the portal. So kudos there. So I kind of feel like maybe you guys got a tie. So congrats. And team 3, gosh, I hope I didn't let you down too much. Sorry. All right, so I'm going to close out of this and go back to our slides. And oh, I got a couple chats. Let's see. Oh, Kaylee says it was helpful to walk through the portal this way. Thank you. Natalie says it was a great activity. Awesome. I'm glad you liked it. I enjoyed it. I learned a lot. So thanks so much. So popping back into the slides, we will kind of turn this over to Athena for just a minute to kind of follow up a little bit on lists, because we didn't do that specifically in our breakout room exercises.
Okay, great. And I'm going to share my screen quick, Mindy.
Great.
I just wanted to touch on this because I don't know if the other groups saw it, but in the case examples that were given, the second family was really looking for information in their own language too. So we found this FAQ, parent FAQ on childhood obesity, and up here at the top, you can quickly translate this in a matter of seconds to any language. So that is something to just want people to be aware of. If you are ever looking for information for families in other languages, that the medical home portal is a resource for that as well. So
thank you.
Quick plug on that. And then to go over lists, I wanted to remind everybody on the upper right-hand corner, you'll have to sign in to access your list. So if you haven't already, create an account. It just takes an address and a password. Sorry, you won't get this screen. My apologies. It just takes a email address and a password. And then I've started a list already based on the request that Pat Rose sent out this week for lists of med peds providers, or internal medicine and pediatrics. And everybody had great responses to that. So I started collecting them here in this list. You can see we just, based on resources, it's hard for us, again, as Mindy said, to have listings for individual providers, but you can search provider names and they're usually associated with a practice. So here, if I expand this listing, you can see here's Phil Eisenberg is listed down here as having an internal medicine peds specialty. And then there were several at Sugar House. Down here in the provider profiles, we've listed all those out. Kira Watson, Molly Dose, Suzanne Coachella, and Jennifer, is it Leisure? I'm not sure how to say that last name, with some of their specialties and interests. So I've added those two, and I just wanted to walk through adding a few more that were listed. So once I've made this list, which again, let me just navigate back here really quickly. I just made it by hitting this create new list button, and then I titled it. And then from here, I can go over to my service directory. There'll be a little navigation bar up at the top, which tells me which list I'm currently working in. So this is the Med Peds one. And I can search for things a couple different ways. I'm going to show you 3 ways to add providers to this list. So I had some people responded with specific names of providers to that list. So Solomon, I know, was one of them. So I'll just search that name. And I know it's not this, so I'm gonna assume she's a Redwood. And sure enough, reading the provider profile there, she's listed with some of the other providers that were also mentioned. I think these 3 were also mentioned. So I can add this practice to that list. And I'm going to add it under the meds peds physician, since this list is specifically for that. Go back to the directory. Also, a practice was mentioned, Copperview Medical Centers. So I'll look up them really quick. And there they are. And again, it's got some information right here in the provider profile specific about those, or specific to those providers. So I'll add this one. And then I think that covers all the ones that were mentioned in replies to Pat about this question. However, if we go back to our directory and browse through our categories, there is a category specific to med peds providers, med peds physicians. So I could also click there and just double check and make sure that I got everyone. Oh, looks like I didn't have this Madison clinic on there, so I could add that one. It looks like there's this Paige Patterson is there, so that's one that maybe people are less aware of. We can add her to that list as well. And now I can go back to my list. I've got a nice compiled list of all those practices that have med peds providers. I could put a specific note in here describing this list. And then I could also add a note here that's specific for a family that would not be saved. You can put PHI information in this box. And then I could also share it with all of you. So if I get this URL, I'm going to copy it right now and put it in the chat for all of you to look at. If I can figure out how to get to my chat. I might have to stop sharing to do that, but I'll share it with all of you as soon as I stop sharing my screen.
Thank you, Athena. Thank you, thank you. Yeah, so it was kind of a lovely request that Pat had, because we felt like, hey, we've got some of those providers, and we'll make sure that we have them all based on all the responses, and then we can create this list and make sure that you guys have it, because those kinds of providers are increasingly important, we know, to be aware of where they're at and contact them as a referral for patients. And we just want to encourage you to try and utilize the list feature. The thing that's nice about it is that if we update something, as we just have, your list, your electronic list will also get updated. So we do think it's helpful in that way. And I know that, you know, everybody has kind of their own approach to doing this. We're asking you to do it one more way. And that may not fit in with your workflow, but please know that this is, you know, a resource for you. And if you have questions or need help just utilizing the information in our services directory, you can always reach out to us. Whether it's Athena or myself, we'd be happy to try and create a list for you, or just come up with some services. Looks like, yes, folks are having trouble with that link, so we'll figure that out.
Yeah, sorry about that. You shouldn't have to have a login to view it. Somebody just messaged me that question, so I will double check on what's going on there.
So Athena, can you technically like save these lists? So if you have like, can you just save a list in there? Is that where you save things and then you are able to pop in a long list? Is that the purpose of, I guess I'm trying to figure out how I use this feature.
Yeah, so any list you create saves in your own account. So anytime you'd sign in, you'd see all of your lists of providers. So let's say, for example, you consistently are giving out the same, 5 practices to people who have a concern for autism. You could generate a list that then you could share, either do the URL via email or print and share as well to parents or families.
I love this. I have to practice. This is
Yeah.
going to be great, but I'm not good at it. But yeah, this is great.
And we have a couple tutorial like webcasts that walk through a little bit slower about how to do this. So if you're interested in those, just email me as well, and I can share those with you also.
Actually, Athena, if you don't mind, maybe right after this, you could send an email just to the listserv email address that links to the tutorials and gives the easily accessible version of that link. Then they won't have to wait until I put together the resources of the month. It'll be fresh on our minds, and that would be great if you could send that out in the next little while.
Mm-hmm.
Awesome. Okay, I see a question. Could we think about doing another exercise like this in a few months? Yes, excellent, you bet. Yeah, I had fun, so I'm down with it. And maybe we'll have real prizes. Maybe we'll up our game.
This is Eric again, but I think it emphasizes that power of community. I'm always so impressed when someone has an issue and it goes out to everybody and boom, 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 the replies come in and say, have you tried this? What about, we've had to look with this resource. So I think it just goes to show you're not alone. So use the list, but if you're kind of not sure, send out that, that request to Mindy to send to the group.
Yeah, do all of the above.
I want to remind everybody too that, you've got a big help when you've got something that's not an easy fix and you are really struggling to find help. There's really a good resource in integrated services. They can really pull off some things that we can't sometimes. And so that's, they're my big guns. When I need big help, which, it's not super often, but they've got those medical professionals that are employees there that can sometimes make connections that, well, you guys are all medical too, but you know what I'm saying? They're good. They can do some of the harder work that we can't figure out.